All right. Hello, everyone. My name is Ryan Marable, President of the National Pharmaceutical Association. On behalf of the NPhA Board of Directors, I would like to welcome you to the Meet the Candidates Forum in preparation for the 2022 NPhA election cycle. Thank you all for joining us this learning session where we will hear directly from our NPhA Board of Director Executive Officer candidates. Members who are active in good standing within NPhA will soon receive access to the electronic ballot to cast their official vote for the next wave of leaders within the association. A major highlight of this election season is the opening for the role of President-elect, who will ultimately assume the highest position within NPhA, which is President and Chair to the NPhA Board of Directors. I would like to express my sincere gratitude to each of our candidates who have accepted their respective nominations. These individuals have made the noble decision to choose service through their active participation as leaders of NPhA. For some, this may be their first interaction on the national stage for NPhA. For others, this is a return ride on the NPhA train. Either way, your dedication and commitment to NPhA is vitally important for the future of our organization in carrying out the mission of service to the underserved. Please note that we will not be taking questions live from the audience during this event. However, questions that have been submitted electronically before the event have been submitted and may be presented during this event to our candidates. At this time, I would like to transition the virtual stage to our official Meet the Candidates moderator, NPhA Immediate Past President and Chair to the Nominating Committee, Dr. Lakesha Butler.
Thank you so much, President Marable, for that introduction, and thank you all for joining us this evening. This is certainly an exciting time for us as we embark upon our election season. As has been mentioned, we have our candidates for President-elect and candidate for Secretary. All candidates will be introduced by myself, and they will have the opportunity to follow that with an opening statement regarding their interest and vision for the position. Before I begin, I would like to thank the other members of the nominating committee, Dr. Kendrea Jones and Dr. Sienna Miller. I will go ahead and begin. We'll start with our secretary nominee. Dr. Marcia Fields was born and raised in North Carolina, and she completed an undergraduate degree from Wake Forest University in 2006. She then pursued her pharmacy education at Virginia Commonwealth University, graduating in 2012. While in pharmacy school, she was active in the NPhA chapter and established the collaboration with the university's medical and dental schools to facilitate the health screening and services provided through congregations around Richmond to Assure Shelters program. As a result of her work, VCU's NPhA chapter earned the Rite Aid Chauncey I. Cooper Chapter Excellence Award in 2010. After earning her PharmD, she completed a postgraduate drug information residency. And after the residency, she worked short-term with Mylan Pharmaceuticals. She relocated to Florida, starting a career with the Federal Bureau of Prisons. After committing to work with an underserved population, she also took the oath to protect, promote, and advance the health and safety of the nation and joined the U.S. Public Health Service later that same year. She is excited to serve and is looking forward to fostering new relationships within the NPhA family. And so I will turn it over now for Dr. Marcia Fields to provide us with her opening statement.
Good evening to everyone. Thank you for this opportunity to share with our members tonight. Dr. Marable, thank you for the warm welcome. And Dr. Butler, thank you for the kind introduction. A little bit more about me. I've been a pharmacist for 10 years and have worked in areas such as drug information, pharmacovigilance, correctional medicine, drug inspections, and now in a liaison capacity to the pharmaceutical industry. My vision for secretary is to be accountable for accurate and timely documentation of written correspondence as it relates to NAPHA. My objective in applying for this role is simple. I want to be in the know. This position would afford me the opportunity to gain valuable information of the inner workings of NAPHA and our commitments to patients, students, and other entities. With the knowledge that I gain, I hope to be a resource for colleagues. I enjoy connecting people and relaying pertinent and applicable information. For example, while in my previous role as an investigator with the Food and Drug Administration, I learned that the agency paid for a subscription to a language learning platform for investigators in our office. It was a tool that could aid investigators during travel and completing inspections, so I made sure to share it with coworkers in my training cohort. I recently transferred to a different position, a different office, and the office that I'm assigned to now pays for continuing education subscription component to the pharmacist letter. So I then share that good news with pharmacists on my team. I want to be known as someone who is resourceful, helpful, approachable, generous, and willing to share what I know. This concludes my opening remarks. Thank you.
Thank you so much for those opening remarks, Dr. Fields. At this time, I will provide a question that has been prepared for you specifically. So the question is, and this is actually a question that will be asked amongst all of our candidates, please share how your previous leadership and service experiences have prepared you for this national leadership opportunity.
Thank you for the question. As pharmacists, I think we all consider ourselves good record keepers and individuals who pay attention to details. So in that regard, I highlight those two strengths that prepare me for secretary. Currently, I serve on NAPA's newest task force, the Research, Education, and Scholarship Committee. Since September of 2021, I've maintained the meeting minutes for the group. Within the Public Health Service, I serve on 2 different charter and bylaw committees. My contributions serve as a part of a larger effort to ensure that the documents that govern the Black Commission Offers Advisory Group and the Junior Officers Advisory Group are updated regularly and reflect the current operating procedures.
All right, wonderful. Thank you so much, Dr. Fields, for your response to that question. At this time, we are going to shift to our president-elect candidates. We will follow the same format with a brief introduction from myself and then the opening statement from each candidate and also questions that have been prepared for the president-elect candidates. We will begin in alphabetical order. And so that is starting with Dr. Tamara McCants. Dr. McCants is originally from Brooklyn, New York, and received her Doctor of Pharmacy degree from Florida A&M University in 2001. Upon graduation, she came to Washington, D.C. to complete a community pharmacy residency program with Grubbs Care Pharmacy and Howard University. She has since dedicated her career to increasing the capacity of pharmacists to be a major contributor in the achievement of favorable health outcomes, especially for the underserved population. Dr. McCants is currently an assistant professor at Howard University College of Pharmacy, and during the past 10 years, she has served as the director of experiential programs and director of residency programs and practice transformation. She has received over $1 million in grant funding to execute training and community outreach programs. And these experiences, she's had a number of experiences on the national level, a longtime member of the American Pharmacists Association, in which she has served as the delegate for the District of Columbia, She served 8 years as the treasurer for the Washington, D.C. Pharmacy Association, and she recently completed her term as chair of the Minority Faculty SIG for the American Association of the Colleges of Pharmacy. And these particular experiences have allowed her to hit the ground running when appointed to the board of directors of the National Pharmaceutical Association in 2019 as the convention planning chair. Just a few notes from her tenure on the board. She did lead a unified NPhA SNAFA convention with over 600 attendees in Houston. Also, she has conducted zone director meet and greet events, House of Delegates training. She's chaired and successfully implemented the first virtual convention for the association. And she's recently been appointed as the Zone 1 director, in which she currently serves. She has been intentional about engaging members from Vermont to West Virginia, and under her leadership, the Zone 1 membership has increased by 75% in 2 years. And so at this time, I'd like to turn it over to Dr. McCants for her opening statement.
Thank you, Dr. Butler, for that introduction. Good evening, everyone. Thank you so much for being here. Before you leave tonight, I want to assure you that I am ready to be your next president-elect and then president for the National Pharmaceutical Association. And you may ask, what makes Dr. Tamara McCants ready for this servant leader position? As the next president-elect, my vision is for a mighty NPhA. The word mighty is defined as displaying uncountable power, strength, force, or influence. We will have an NPhA that will continue to build on the formidable foundation established by past leadership. My experience with NPhA in a variety of capacities, as well as my involvement in other local and national pharmacy and civic organizations, is what has prepared me. My experience and my passion will ensure that NPhA is visible. I will continue to make sure that the voice of NPhA is not just heard, but influences the future of pharmacy in a way that benefits all. Practicing pharmacists in the community, hospitals, academia, federal government, and pharmaceutical industry. Also, the voice of student pharmacists that are striving to achieve their dreams and the pharmacy technicians that support all of us. During my 6-year presidential commitment, NPhA will effectively mobilize as the premier pharmacy organization to highlight and address issues affecting Black and Brown pharmacists, student pharmacists, and pharmacy technicians. My efforts will be focused on strengthening the infrastructure of the organization to be more effective and to better serve all communities. We will tell our stories and celebrate our successes and achievements. This vision will be executed by boldly achieving the following objectives. 1, improving governance effectiveness by ensuring that we have a comprehensive strategic plan as well as documented board-approved policies and procedures. 2, increasing advocacy efforts to position NPhA as the preferred pharmacy organization to address health disparities and achieve health equity. As we serve to meet the healthcare needs of our community, everybody should be aware of our political agenda. Mobilization will occur through national organizations and state pharmacy associations. 3, expand and lead collaborative efforts with other pharmacy and healthcare organizations and corporations. We will continue to craft joint statements, and we will strive to be a named organization with the Joint Commission of Pharmacy Practitioners. And last but not least, we will continue to cultivate our membership. We will build innovative agents for change and transformation through various levels of engagement and leadership development. NPhA will be your safe place to come back and get rejuvenated, develop your skills, and go back out there and lead in your workplace, practice, organizations, state pharmacy associations, and state boards of pharmacy. So I really hope that you will vote Tamara McCants for president-elect, and together we will accomplish this vision. Thank you.
Thank you so much, Dr. McCants, for providing your opening statement and your vision. At this time, I would like to introduce our next candidate, Dr. Gayle Tuckett. Dr. Tuckett is a native of St. Thomas, U.S. Virgin Islands, and she spent her formative years in Virginia, where she obtained her Bachelor of Science degree with biology from Old Dominion University in 2007, and a Doctor of Pharmacy degree from Virginia Commonwealth University in 2012. Upon graduation, Dr. Tuckett began her career as an ambulatory care pharmacist at Crown Point Healthcare Facility under the Indian Health Service. And within a year, she worked with the resident to establish a tobacco cessation clinic and with her pharmacy chief to create a pain clinic. In 2013, she transitioned to another center that was affiliated under the Indian Health Service in Arizona. And she was commissioned as an officer in the U.S. Public Health Service in December of 2013. Dr. Tuckett currently holds the rank of commander, and throughout her time at the Arizona Center, she has held various leadership roles and gained experience in the areas of diabetes, asthma, and tobacco. Dr. Tuckett has served 2 years at the Commission Corps headquarters in Rockville, Maryland, and she was instrumental in updating, revamping, and achieving approval of 20-plus-year-old substance use policies for over 6,000 public health service officers. While in school and throughout her professional career, Dr. Tuckett has remained committed to both SNAPA and NPHA. As a student, she served as the local SNAPA chapter as president-elect, president, and immediate past president. And under her leadership, the chapter received the Rite Aid Chauncey I. Cooper Chapter Excellence Award for the large chapter category. As a pharmacist, she remains engaged as a member, assisting with new practitioner events, and eventually became the secretary, serving for over 6 years from 2014 until 2020. In 2021, SNAPA invited Dr. Tuckett to serve as the keynote speaker for their regional conference, and she is a lifetime member of the association and continues to be highly active even after her term as secretary, also serving as a delegate for Zone 1 in 2021, and on both the resolution and bylaws committees and the research, education, and scholarship committee. At this time, I will turn it over to Dr. Tuckett for her opening statement.
Thank you so much, Dr. Butler, for the introduction, and good evening to you all, and thank you for taking some time out of your evening to hear from each exceptional candidate tonight. I am interested in taking on the role of president-elect because I have the skill set and conviction to elevate the legacy of the organization and take it to the next level, which includes greater visibility, significant collaboration, and exponential growth. With the culmination of my experience in NAPHA and SNAPA, and just thinking of John C. Maxwell's law of timing, this is the right action at the right time, and I believe the time is now to step into this role. As for my vision is to see a united NAPHA being the voice for all pharmacists of color and the communities we serve on issues that impact us as it relates to pharmacy and health. I envision a NAPHA of influence built with 3 arms: strength, structure, and advocacy. Instead of minority organizations and associations operating in silos, it is my vision to see us come together and have them feed into NAPHA with us elevating the voice of pharmacists and the patients we serve. Through collaboration with the new entities and building on existing partnerships, NAPHA can have greater reach and more voices promoting a common cause. We can not only gain strength through unification, but also through increased membership, which is necessary to help leverage partnerships and have a greater voice in advocacy. This leads me to structure. They say build it and they will come, but I'd like to tweak it and say build it to meet needs and they will come. I would like to implement having NPhA specialty networks that will focus on and bring together pharmacists practicing in and with similar interests for some of the following areas: metabolic diseases, oncology, women's health, and global health. My hope is to provide more opportunity for members and non-members to see specific areas in which they identify and build further connections. The networks can be used as a forum for clinicians, policymakers, educators, and more to discuss difficult patient cases, concerning legislation and policies, and other challenging issues respective to that network's focus area. Through NPhA specialty networks, we will provide support and community to our members, which will hopefully in turn provide a more well-informed pharmacist with possible solutions to meet the needs of patients and/or the stakeholders they serve. In keeping with structure, I'd like to provide greater transparency and consistent information sharing, which will help build or rebuild trust between members and leadership. Establishing consistent and early communication sets a cadence that members can appreciate and demonstrates a reliable organization. Rubrics should be in place that provide greater objectivity when determining candidate slating, awardee selection, and continuing education speakers. Aside from transparency, rubrics can offer valuable feedback to non-selectees as a way to improve their chances the next time around. Another important item relating to transparency is the showcasing of our history on our website. It is important for members and the public to understand the why and foundation of the association's existence. To help maintain a strong foundation, we should also have continuous seamless transitions and leadership support. Thus, I would also like to create a past president's advisory board. This board will operate to provide guidance and support to current leadership given their experiences and historical knowledge. Lastly, our action and presence need to be palpable. This happens through a twofold approach of boots on the ground to connect locally, impacting our community directly, and with policy to create a widespread, long-lasting effect. NPhA cannot become an influential, well-recognized association without being strong in the realm of advocacy. I want to empower members to become advocates at every level and serve as force multipliers on NPhA resolutions and positions. Through educational presentations and templated communication, we will get back to basics, contacting Congress and local and state government officials and performing successful Hill visits on issues that matter to us. With this and my additional plans concerning each arm, we will create a well-informed membership for voting in all election levels and an association that is respected by private, public, and federal organizations. Using this platform, I hope to create a unified NPhA of influence. I hope you vote me to be your next NPhA president-elect. Thank you.
Thank you so much, Dr. Tuckett, for providing us with your opening statement. So at this time, I have a couple of questions that I will pose to each of you, Dr. McCants and Dr. Tuckett. You'll each have the opportunity to answer, and then we'll move on to the next question. And so the first question, both of you have kind of touched on this, but if you want to expand, and I'll start with Dr. McCants, please share how your previous leadership and service experiences have prepared you for this national leadership opportunity.
Thank you so much for the question. In order to be successful in this national leadership opportunity, your president-elect should already be familiar with the national landscape of not just the profession of pharmacy, but healthcare provision overall, and especially how it affects minorities, especially Black and Brown people, and the underserved populations. So not only do I know who the players are, I have been engaged with shaping the issues for the past 20 years in several ways. I have served as committee chair in various capacities with the American Association of Colleges of Pharmacy, which is a national organization for academia or pharmacy schools. As previously mentioned, I have served as a delegate of the American Pharmacists Association House of Delegates for years, to the point where I have been appointed several times by previous speakers of the House on their policy committees. I am currently serving as the chair of the District of Columbia Board of Pharmacy. So with that opportunity, I have ensured that the District of Columbia is represented by serving as a delegate for the National Association of the Board of Pharmacy. I have also been appointed there by 3 past presidents on various task force and committees. So I have spent previous years having these engaged conversations and looking at where the future of pharmacy is going. But in addition to showing up as a leader, I am also a doer. I work alongside my team to ensure that the work gets done. And I also will venture out to say that I love to have fun while I'm doing it. I am naturally a visionary. I'm able to define and clarify achievable goals. Then I also can motivate and empower others to become a part of the success. I always see the best in people, and I encourage people to hone into their strengths so that everybody can feel a part of the success. That is how I co-founded a nonprofit organization in 2002 to address health disparities in patients being treated for HIV and AIDS. That's how I managed over $3 million in grant funding with that organization. It is also how I have mentored 5 students at Howard University to establish the very first pharmacy-specific medical reserve corps in the United States. Little did I know that when that organization was founded in 2013, that we will play such an instrumental role in combating a global pandemic that we will only see hopefully once in our lifetime. It is also the way that I have planned an outstanding conference in Houston, rallying everyone in 7 months, and also the first virtual conference for NPhA. It is the same way we are looking to charter 3 chapters in Zone 1 by June 30th. I hope you can join us in Springfield, Massachusetts in 2 weeks as we usher in the New England chapter. And as your president-elect, you can expect to get more of the same as we work together. All of us will make sure that the success of NPhA is recognized regularly.
Thank you, Dr. McCants. I will now turn the same question over to Dr. Tuckett. I will reread the question. Please share how your previous leadership and service experiences have prepared you for this national leadership opportunity.
Sure. Thank you again, Dr. Butler. So my time serving as a local NPhA chapter president, as legislative and membership benefits chair and Region 1 facilitator for 2 different terms of the NPhA National Board, as the NPhA secretary, as you all heard in my introduction, and Zone 1 delegate, and a few additional NPhA committees. All of these roles have properly prepared me for the role of NPhA president-elect because it has provided appropriate insight into the inner workings of both organizations. In these roles, I have been fortunate to learn the styles and approaches to running for the association, and through closely working with 3 past presidents and knowing what works and what may not be as successful in moving the organization forward. Serving in these positions has also helped me to identify existing gaps and thus come up with possible solutions to close or remove these gaps. My leadership involvement in government groups lets me know what is truly possible for the association with the right strategic thinking and execution. So while I may not have the in-depth experience as Dr. McCants, I have half the practicing experience. I've been a pharmacist for half the time and I've accomplished quite a bit in half the time of being a pharmacist that she has. And she is correct. It is important to have those connections and experience with those organizations. And I have been an avid member of APHA. Additionally, again, going back to my government experience, I've aided for the Assistant Secretary of Health. So having that wide overview of the health system, the health and human services system, I think gives me a better insight into what the, I guess, federal government wants for the whole nation. So it's a nationwide approach. I get engagement and interaction. I see the letters that are coming in, or I have seen the letters that are coming in from different associations. And one association that's always missing is ours. So I really know what it takes to get us on the map, to get us recognized. And I want to see us in the room. I want to see us being able to have a voice in those circles. I've had the experience of writing memos for the Surgeon General through my involvement as the chair of the Black Commission Officers Advisory Group, which has over at least 1,000 to 2,000 members. So while it might not be as in depth with AACP and some other organizations, my strength really lies within an overarching national view and working with those leaders that make the decisions that matter. So those are, I guess, all of the attributes that make me well qualified for a national leadership role.
All right, thank you both for the answers or responses to the question. We will now move on to our second question. And at this time, I will start with Dr. Tuckett for the second question. NPhA is an organization that represents the ideals of minority pharmacists. What do you feel is the most pressing or are the most pressing issues faced by minority pharmacists, and how do you hope to address these issues?
Okay, that's a great question. And when the question was posed, it was a singular question, but it's funny because 3 came to mind. I will start with the first one that came to mind, and that's underrepresentation. So underrepresentation of minorities in the profession of pharmacy is something that was very evident to me attending a PWI for pharmacy school, and not much has changed since I graduated in 2012. And I'm sure my colleague, Dr. Fields, can relate, as we were in the same class. And in the most recent surveys, while Asians do make up 20% of pharmacists, Blacks and Hispanics still only make up 6%. And so nothing drove home how important it is to have appropriate representation in healthcare than the COVID-19 pandemic. Also, representation along with culturally competent care often shows improvement in patient outcomes. So my approach to address this issue would be, 1, to encourage SNAPA to further incorporate partnerships and outreach to local high school and HBCU undergraduate students, increasing exposure to the profession, and then also having them consider a tutoring program in math and science for minority students. We could also explore the idea of using or redirecting funds to provide scholarships to high school students pursuing pharmacy school. We also have, not sure if you're all aware, we do have a couple of resolutions on this topic. So standing on existing resolutions to drive conversations with high school and undergraduate administrations, petitioning for the implementation of a healthcare diversity summer camp at their school, further expanding on this initiative from South Illinois University, Edwardsville. And then the last possible solution would be to partner with NMA and NDA, which are our medical and dental counterparts, to develop content for social media blitzes on a recurring basis. So basically an approach of exposure, content, and engagement. To just touch a little bit on another one that came to mind, it was burnout. And so basically pharmacists have one of the highest rates of burnout among healthcare professionals. And this also affects technicians and leads to increases in turnover rates. So again, going into our toolbox of advocacy, so having discussions with NACDS and lobbying for well-staffed pharmacies with accommodation for breaks to provide quality patient care. Again, our NAPHA specialty networks, if I were to be elected, that implementation would offer a space to share frustrations that can then be raised to leadership to address and provide support among peers, as well as having self-care and well-being webinars to provide the tools necessary to identify, prevent, and/or resolve burnout. And so I'll wrap it up with that. Thank you.
All right, thank you. Same question for Dr. McCants. NPhA is an organization that represents the ideals of minority pharmacists. So what do you feel is the most pressing or are the most pressing issues faced by minority pharmacists, and how do you hope to address these issues?
Thank you so much for the question. Our greatest area of opportunity is approaching our profession in an empowered mindset. This issue is not just specific to minority pharmacists, but it's definitely highlighted for us because of the factors related to racism. Generally though, as pharmacists, all pharmacists, no matter what skin color or hue, are constantly having to prove our worth. We pharmacists, is well known that we just have a PR issue, a public relations issue. And so we constantly have to remind our colleagues and the general public about our education, skills, and our abilities. And sometimes that puts us in a position where we don't feel confident of what we can do. Again, if you throw in racism and imposter syndrome, that is usually occurs in minorities. And it causes us to question whether or not we're even ready to even be in this profession, especially when people see you in your white coat and then they say, can I speak to the pharmacist? And you say, I am. And then they say, well, is there anybody else here? Or when another team member repeats what you just said in the meeting, but they heard it when your other counterpart said it. So under my leadership, NPhA will address this issue, which I feel like is the main issue for minority pharmacists that kind of trickles down to other issues, by optimizing the minority pharmacist workforce to ensure that there is health equity for all populations. The first thing that can be done is to ensure that we have a sufficient number of minority pharmacists. So focus on recruitment of not just pharmacists that want to go into pharmacy school, but students that want to go into pharmacy school, minority students starting from a young age, elementary school, middle school, just to help them to feel empowered about science courses and know that they can pursue a profession in pharmacy. 2, through preparation and readiness. NPhA has to facilitate the pride that we have as minority pharmacists. So continuing to have celebrations like Black History Month and Founders Day for NPhA, and continuing to ensure that we put out quality continuing education, professional development, and networking events for all of our pharmacists all across the country, and ensuring that we are partnering with all other minority pharmacists associations, and that they feel like they can have a seat at our table, and so we can have one unified voice. And last but not least, which I feel is very important, is leadership development. We want to have a strong emphasis on preparing pharmacists, minority pharmacists to lead, empowering them to know that not only can you practice and you can make a difference, and not just on diversity, equity, inclusion, and anti-racism issues, but you can lead in your workplace, you can lead in your state pharmacy association, you can lead in, again, state boards of pharmacies, you can lead in all of these other organizations like ASHP, and we have minority pharmacists there now, but just to unify us so that all of our members can see where they can go.
Right, thank you, Dr. McCants. We do have one additional question that will be posed to all of the candidates, including our secretary candidate. I will start with you, Dr. Fields. The question is, what is your leadership philosophy and leadership style?
Thank you for the question. I consider myself a servant leader that enjoys working behind the scenes. I'm still mastering the art of finding balance among my roles, responsibilities, and aspirations. I'm working to establish healthy boundaries and realize that leaders don't emerge within a vacuum. It's a continuous process of goal setting, constructive feedback, mentorship, and refining one's character. Thank you.
Thank you. Same question, Dr. McCants. What is your leadership philosophy and leadership style?
So my leadership philosophy, as I mentioned earlier, is to see the best in everyone and bring out the strengths in everyone. So knowing that everyone has a place and everyone can contribute, and letting people feel comfortable to contribute at the level that they are. I also So that's my overall philosophy. But in terms of leadership style, it depends on the people that I'm working with. I'm very comfortable with the top-down approach, where if we're feeling like we're having a hard time making a decision, I'm very comfortable with making a decision and deciding which way we can go. And I'm also very comfortable with consensus building and seeing what everyone wants to do and going with that and meeting somewhere in the middle. So I just think that it's just important for everyone to feel like they can be involved and make people feel comfortable about how they want to be involved and maximize their involvement. So whether that's just being a financial member, or whether it's just showing up to events, or if you want to have some type of leadership positions. If there's work to be done, I'm going to seek you out, and working with me, you're going to find out that you have skills and strengths that you didn't even think that you had, because I am going to push you. But I'm going to be right alongside with you, working with you, and supporting you to make sure that you accomplish your goals as well.
Thank you, Dr. McCants. And finally, same question, Dr. Tuckett. What is your leadership philosophy and leadership style?
Sure. So I used to think and say that I was a servant leader, but I believe I have transitioned to a leadership style that is not one thing, but a combination of being a visionary leader, in that I am progress focused, and a pace setting leader, in that I do my best to help and motivate those I lead in their respective roles and responsibilities. When it comes to my leadership philosophy, I'd say I value and evaluate the opinions of all, especially members, in making decisions to best benefit the mission of any organization to which I oversee. I lead from the back while providing assistance to elevate fellow board members in being successful in completing responsibilities, and shield them from any missteps, taking full responsibility. My leadership philosophy can be summed up by a quote from Douglas MacArthur. A true leader has the confidence to stand alone, the courage to make tough decisions, and the compassion to listen to the needs of others. One does not set out to be a leader, but becomes one by the equality of one's actions and the integrity of one's intent. Thank you.
Thank you all so much for your responses to our additional question. At this time, we are coming to a close, but we would like to provide the opportunity for each of the candidates to share any closing words or closing statement. So at this time, I will start with Dr. Tuckett, if you would provide any closing remarks.
Sure. Thanks again, Dr. Butler. I'd like to thank the nomination committee for approving me to be slated as a candidate. And again, I'd like to thank everyone who lasted with us till the end to hear our platforms. Going back to the beginning, I was one of 7 Black pharmacy students in a class of 130. The only Black male was unsuccessful in his matriculation, and one of the other Black females, as you guys heard, is on the panel with me tonight. My involvement with SNAPHA contributed to my success in pharmacy school and the confidence as a pharmacist and in future leadership roles. I joined NAPHA to be the change I wanted to see, and out of loyalty to an organization that carries the same values and that gave me so much. What I shared with you tonight is a highlight of my plan that contains many more details and exact timeline for execution. Please know that with me, you may not get a lot of pomp and circumstance, but I will always follow through, whether through results or updates on why something was unsuccessful. I have 12 years of experience with both NAPHA and SNAPHA and results at every stage. If I leave you with nothing else, know that I am committed and consistent and will do my best to create an influential NAPHA.
All right, thank you. And Dr. McCants, if you would like to provide us with any closing remarks.
Thank you. First, again, it is just an honor and a privilege to even be slated as a candidate for president-elect of this great organization that was founded 75 years ago, when there was no place for minority pharmacists. And pharmacies back then was the safe haven for all communities. And I want to thank so much my fellow colleagues that I'm sitting on a panel with, because you all just, again, highlight how the future is bright for NPHA, regardless of the outcome of this election. But I do want to just highlight that I am committed, I am dedicated, I have the experience, and I have the passion to lead NPHA to where it needs to go for a solid foundation for the next 75 years. And I want everybody to get involved with the journey to NPHA successes. I've mentioned a few things about me, and I have been a pharmacist for 21 years. And if you want to learn more about me and what we will be able to do together, you can put Tamara McCants or Tamara Foreman in your favorite search engine. But seriously, I am a highly motivated servant leader with the skills, fortitude, and vision to continue to propel this great association to be mighty and effective. There is so much that we are going to be able to do, and we are responsible right now to continue this legacy. So please join me in building a mighty NPHA. Vote Tamara McCants for president-elect.
All right, thank you. So we have heard closing remarks from both of our president-elect candidates. And finally, Dr. Fields, did you have any closing remarks?
I do not have any concluding remarks, but I would like to extend my appreciation as the others have. Thank you for taking your time out of your schedules to join us this evening, and I look forward to your support in the candidacy of secretary. Thank you.
Thank you all so much, the candidates. You certainly deserve a round of applause. We thank you so much for your responses and providing greater insight to your candidacy. Thank you all for joining us. I did want to just provide a little bit of information about our elections. They will start or open up on tomorrow. So May 4th will be our start date for the elections. If you are a member of NPHA, you will receive a message, an email message with information regarding the election. The elections will conclude on Friday, May 13th. If you are not a member, you still have time. So please join. You have to be a member in order to vote. Once again, our elections will begin on tomorrow, May 4th, and conclude on May 13th. At this time, I'd like to once again thank you so much for joining us, and I'll turn it back over to President Marable for any closing remarks.
Wow, what an awesome candidate meet and greet session that we just had. Once again, I do want to express my appreciation for all of our candidates for presenting today. I also look forward to learning more about our candidates who are not present speaking today, but are also slated for this open election cycle. As stated, I hope you all have a great evening, and thank you for your attendance.